Assalamu alaikum, students. Today we are going to discuss major depressive disorder, or this disorder is also known as depression. What is depression? Depression is an emotional state marked by great sadness, feelings of worthlessness and guilt, withdrawal from others, loss of sleep and appetite, and loss of interest in usual activities. Depression is known as one of the mood disorders that causes a persistent feeling of sadness, loss of interest in almost everything. So, how do we diagnose depression? The formal DSM 4TR diagnosis of major depression requires at least 2 weeks of depressed mood or loss of interest in any kind of regular activity. Another symptom is sleep or appetite disturbance, loss of energy, feelings of worthlessness, difficulty in concentrating on regular work, and also one of the major problems that depressive patients are prone to is suicide. Now let's talk about prevalence. The prevalence of depression has increased in the mid 20th century, and it has been increasing day by day because of our lifestyle and the need of not having enough. Today, because of technology and a less social lifestyle, the prevalence has been getting high in people over the age of 30 and in their teens. So, it is a very common prevailing disorder which affects almost the young adults and the old aged people because of the fact that when they are above 60 they have no job because they retire from their jobs and they have nothing productive to do, so they are more prone to this disorder. The age of onset. Many research studies have shown that the first onset of major depressive disorder occurs in people in their 20s and 30s, and and it's also common among the old aged people after their 60s. Now, there are many theories that define depression. So, number one is the psychoanalytic theory. The psychoanalytic theory is given by Sigmund Freud and describes depression as is as it is created in early childhood. Because of the loss of a loved one, the anger of the person of losing their loved one is turned inwards, and then this anger is later cannot be expressed to the people around them, and they then become depressed, or they feel very, very helpless to do anything. So they become prone to depression or become depressive patients. In addition, the mourner feels deserted, alone, and directs his or her anger inwards and blames themselves, and then becomes depressed. So, this is the psychodynamic view of depression given by Sigmund Freud. So, this is for today now. We are going to discuss the latter part of the depressive major depressive disorder in the next video. Uh, I will be happy to receive your feedback, and I would like you to suggest any topics for discussion. Thank you.